here at the new location of the Veterinary Emergency Group in Clearwater, and joining us now is the medical director, Dr. Kevin Kelly. Thank you for talking with us.
My pleasure.
Yeah, it is so wonderful to walk in and see how open it is in here. That is what makes you guys special, right?
It's part of it, definitely. It gives us the opportunity for owners to stay with their animal the entire time they are here and also see what's happening in the hospital, so nothing's behind doors.
Yeah, it's really a scary time when you're bringing your pet, your beloved pet, in when something's wrong with them. Talk about how you're different than going to a different emergency clinic.
Certainly. If you've ever been to an emergency hospital, whether it's with your child or with your pet, usually, regardless of your medical background, you don't have the ability to help them. Here instead, when you walk in, you're greeted immediately, you're kept with your pet, the doctor's over immediately to talk with you, see if your animal's stable, and then what recommendations they make for treatment from there. So the whole time you're with that pet when we're doing procedures, whenever we're getting diagnostics done, whenever we're doing therapies, and it lowers the owner's and the pet's anxiety level drastically. So instead, that animal's reassured because mom or dad's there.
Yeah, absolutely. So the exam tables are right here. Talk about this Rover design,
Sure.
if people haven't heard of that before.
Sure. Rover stands for Radically Open Concept Veterinary Emergency Room. And the purpose of it is that when you walk in, there's not a greeting area, there's not a waiting room. You're immediately back where you see the doctor and see the medical staff.
Yeah.
So as a result, there's no waiting and there's no handing off of your pet to somebody else. They're with you. We make you comfortable, make sure you feel at home, make sure you understand what's going on, because that's the scariest part about an emergency room visit.
Yeah, of course. I mean, the tables are right here. You can see them when you're walking in. And when you're talking about you stay with them, even if they have to have a surgery, as an owner, you're able to watch and see what's happening.
Yes, there's perfect transparency, a lot of education about what's happening and setting that expectation with the owner. But if we're in surgery and it's a sterile room, you're standing outside of it watching through the window. You can actually see into our x-ray suite. You're not allowed in there either. But otherwise, if your pet has to stay the night, we'll set you up with a pull-out sofa even, have them comfortable, and that way the owner and the animal knows when it's time to go home.
I just love that when you said that you could stay here overnight, because it's scary if you're just going to drop your pet off, but also you're thinking about the fact, is my pet scared being there and not feeling well? So that's a really unique situation to be in.
Yeah, we see so much separation anxiety in people and in their pets nowadays. Yeah. So instead of having to medicate through that, actually having mom or dad there reassuring them, helping take them on their walks, getting them to eat sooner so they get to go home sooner, it's a huge benefit.
Yeah, we love our pets, so of course we love to hear that. Let's talk about, we're in the fall now, we're going into winter. What kind of emergencies do you typically see around this time?
Halloween, we definitely see, of course, a lot of chocolate ingestion, a lot of candy. There's a lot of things around the house, sometimes even decorations that they get into. And that holds true for the other holidays as well. The other big thing is our social calendars change with the holidays. We have people visiting, we're traveling, we have a lot more situations at home that may induce anxiety in our pets. Mm-hmm. So giving them a safe space to be away from it, making sure they're microchipped in case they get out the door when someone leaves the gate open so they can get safely back home, and then helping to reassure them at home, and there's different tools that your veterinarian can help you with there.
I think that a lot of people get worried if their pet starts acting differently. How do we know when we should be bringing our pet to an emergency clinic?
Well, one of the benefits here is whether it's an owner, a referring veterinarian, or one of their staff members, if anybody calls with a medical question, they get on the phone with the doctor. So it's the doctor telling them what's going on, helping to try to explain it. And if they're concerned, telling them, come on in. We'll put your mind at ease at very least. If it is something significant, we'll help you with it.
Wonderful. Is there anything else that people should know when we're thinking about coming to an ER that you want to be prepared for as you come in, especially to a unique, special place like this?
The biggest thing is just being patient. Like any ER, sometimes there is a little bit of a wait. You will see a doctor right away, and they'll get to your animal and take care of you and your pet as soon as possible. But being patient, being kind to them, because it is a high-stress environment. You don't know us like you do your regular veterinarian, but we are here to help.
Thank you so much for showing us around here and for talking with us. We appreciate it.
My pleasure.